So tisa-cel and axi-cel are two commercially available products that are approved for the use in some regions for relapsed follicular lymphoma in the third line, and of course they have other approvals as well. Axi-cel is known as Yescarta and tisa-cel as Kymriah to some of your audience, and essentially what we were wanting to do is have a look at how the two pivotal trials in follicular lymphoma compare to each other. The study that you're referring to was funded and supported by Novartis. And what we did is we had a look at patient-level data from ELARA, which is the pivotal trial in follicular lymphoma from Novartis using tisa-cel, and compared it with summarized data from ZUMA-5, which is the equivalent study of axi-cel. And the question that we asked is, how much do patient characteristics contribute to the outcomes, both in terms of efficacy and toxicity? Now, of course, this is not the same as a randomized study, but it's just, I suppose, a hypothesis-generating exercise. ZUMA-5 was different from ELARA because far fewer patients had received bridging treatment, whereas in ELARA, a moderate number of patients had received bridging treatment. We found if you remove the patients who had not been bridged from the analysis, then the progression-free survival curves completely overlapped. When you then did a matched adjustment, matching the patient characteristics within ELARA and ZUMA-5, you saw that overlap persisted. We then did an exploration of the whole patient population that had been treated with follicular lymphoma in ZUMA-5 and in ELARA, so putting the bridged patients back in. And we saw that numerically there was slightly higher complete remission rates and progression-free survival in the ZUMA-5 population, but these were not statistically significantly different, particularly with respect to progression-free survival. And that when you then moved to match the patient groups with a weighted adjustment, the difference was completely removed, so the progression-free survival curves overlapped. When we looked at toxicity, crude toxicity rates between the different products, the rates of neurotoxicity and cytokine release syndrome were higher with axi-cel compared to tisa-cel. And that's not particularly new information. That has been a relatively consistent finding across studies. And that remained the same when you did this adjusted comparison. So if I was to summarize the result of this, it would be that the apparent difference in crude complete remission rates and progression-free survival in the axi-cel study, ZUMA-5, may be due to patient characteristics, knowing that the patients in ELARA appeared to be slightly higher risk group of patients and a larger proportion of patients were bridged.